Hypertension in pregnancy poses a great risk on both the mother and the baby. It's otherwise called preeclampsia. Preeclampsia is caused by the placenta not forming properly. Now, if this happens, it will cause blood flow to be insufficient, which can otherwise lead to abnormal function of the blood vessel. So when this happens, a pregnant woman's blood pressure increases. Preeclampsia happens in the third trimester, around 20 weeks of pregnancy. At that point, you start experiencing symptoms like persistent headaches, vomiting, nausea, blurry vision, abdominal pain, especially in the upper abdomen. You also experience swollen feet, swollen hands. You also notice that you are gaining so much weight, that is sudden weight gain. You also experience difficulty in breathing. Another most prominent symptom of preeclampsia is protein in your urine. But protein in your urine is usually detected when you do urinalysis. So that is why it is advisable that you start your antenatal class very early and also run the diagnosis that comes with it. So once protein is found in your urine, it is one of the symptoms of preeclampsia. The dangerous thing about preeclampsia is it poses a high risk on you and your baby. For the baby, it stops blood flow to the placenta. And we know that the placenta is connected to the mother. So if there is no blood flow from you to the baby, it's very risky, and this can lead to stillbirth or premature delivery. While to you, the mother, it can damage some vital organs in your body. Organs like the kidney, the liver, the brain, and can potentially lead to stroke if not handled properly. Who is at risk in developing preeclampsia? Number one, if you're hypertensive before pregnancy, you are at risk in developing one when you get pregnant. Number two, if it is your first pregnancy, some women develop it in their first pregnancy. So it's not for everybody though, but some women, they usually experience preeclampsia in their first pregnancies. Number three, if you have experienced preeclampsia in your previous pregnancy, there is every possible means that you will experience it in your second or your third pregnancy. Number four, if you're diabetic, naturally you're diabetic. Yes, diabetes can actually trigger preeclampsia in pregnancy. So it is also a risk factor. Number five, if you have any autoimmune disorder, you are at risk. Number six, if you have a kidney disease before pregnancy, you are at risk in developing preeclampsia. Number seven, if you have multiple gestation, like maybe you're carrying twins, triplets, quadruplets, you're having multiple gestation, you are also at risk in developing preeclampsia. Number eight, if you are above the age of 35 before getting pregnant, you are also at risk in developing preeclampsia. Number nine, if you are obese, your body weight also matters in pregnancy, without pregnancy. So if you are obese, then you get pregnant, you can actually develop it. And lastly, number 10, if there is a family history of preeclampsia, you are likely to develop one. This is when gene comes in. So it's actually also a genetic factor. So now, how do you prevent preeclampsia? Sometimes it is not preventable, but there are some certain factors that can help reduce the risk. Factors like avoid excess weight gain, like I mentioned, there is obesity as one of the risk factors of developing it. So avoid excess weight gain. Also control existing conditions like hypertension, diabetes. If you know you're diabetic or you are hypertensive, endeavor to control it well before pregnancy so that it will not pose a high risk of you developing preeclampsia. Another factor is eating healthy, which will help you to maintain a healthy weight and also reduce your sugar level and your blood pressure. Quit smoking and quit drinking of alcohol. Take your antenatal class seriously and register on time. If you know you are diabetic or you are hypertensive before pregnancy, register on time and also take the antenatal class seriously. Lastly, and most importantly, speak to your doctor. Don't hide anything you feel, your medical history from your doctor. Speak to your doctor at every point of antenatal visit. It will help you to, reduce the risk of developing preeclampsia. Another advice I would like to give to pregnant women, endeavor to check your blood pressure every week. It will help to fast track how your blood pressure is doing. Even if it's not on your antenatal day, you can always walk into any pharmacy close to you and just check your blood pressure. It's really, really important. If you can afford on getting the blood pressure machine, then fine. But if you can't, just walk into any pharmacy, check your blood pressure every week. It will really help you to fast track how you're doing, and if you're doing great, if you're not doing fine. Okay, so that is all about pre-eclampsia. Endeavor to drop your questions in the comment section, and don't forget to like, don't forget to share, and don't forget to follow for more.